Welcome to our show Life Matters. Today we are going to discuss about disease and advanced treatment. To discuss on that topic, we have three doctors from India as our guests, Dr. Santosh Shetty, Dr. Rajesh Mistry and Dr. Abhishek Srivastav. Dr. Santosh Shetty is the Chief Executive Officer and Executive Director of Mumbai-based Kokilaben Dhirubhai Ambani Hospital, a doctor by training, an able administrator by profession and a sportsman by spirit. He currently spearheads the growth and expansion of Kokilaben hospitals with 3 multi-specialty hospitals and 3 super-specialty cancer centers currently in operations. He is associated with Kokilaben Hospital, Mumbai since the beginning. Dr. Shetty did his MBBS from Mumbai University and has had his management training at reputed Tata Institute of Social Science and in US, Singapore. Dr. Shetty is a qualified in ABH and committed to create world-class institute in India where healthcare is accessible to all. Dr. Rajesh Mistry, our another guest, is the Director of Surgical Oncology at Kokilaben Hospital, a former professor and Chief of Service at legendary Tata Memorial. Dr. Mistry is seen as a father figure among cancer surgeons in India. He has over 35 years experience in lung cancer surgery and he is a trained robotic surgeon. And finally, I would like to introduce Dr. Abhishek Srivastav. Dr. Srivastav serves as the Director of Physical Medicine and Rehabilitation at Kokilaben Hospital. He is a PhD in neurorehabilitation and has further trained at Cleveland Clinic, USA and Singapore General Hospital, Singapore. Welcome to our show. 3 doctors from Kokilaben Hospital. We would like to know something about Kokilaben Hospital at first. Dr. Shetty, would you please say something about this hospital?
So the Kokilaben Dhirubhai Ambani Hospital is a not-for-profit initiative of the Reliance Group, which is among the largest corporate groups in India. So this hospital represents the vision of our chairperson, Mrs. Tina Ambani. So it's a 750-bed multi-speciality quaternary care hospital and we are just finishing 14 years now since inception. So as a hospital, what we've done is we've brought about a paradigm shift in the way hospital or healthcare is delivered in Western India. So there are a number of unique features about this hospital. It's the only hospital in the region to have a full-time specialist system. So all doctors who work in our hospital are full-time employees at the hospital. They are dedicated and committed to one hospital, which is very different from the way most other hospitals in the region are. The other thing is we encourage them to follow subspecialty practice. So in each of the specialty, we have got multiple subspecialists who only focus on that particular area. That's as far as our talent pool goes. The second important pillar for us is technology. So as an institution, we've taken a leadership role in technology. So there are a number of technologies that we've installed at our hospital, which are for the first time in India, for the first time in Asia, because we believe technology can be a key differentiator and can help in improving patient outcomes. So whether it is the robotic system, whether it is our edge system for cancer, there are a number of systems that are installed for the first time. Similarly, Dr. Abhishek, I'm sure, will touch on rehab robotics. That's again another area which is very, very unique to us. The third critical part is, as far as our hospital goes, is world-class infrastructure. So the way the hospital is designed is taking into consideration all the patient safety and quality parameters. So it's designed as per the latest American Institute of Architecture design, and all the air conditioning units, the air handling units, the air changes, all of them are designed in such a way that we have the best infection control practices in the region. So these 3 pillars, which is talent, technology and infrastructure, are the foundation on which this hospital has been created. What has happened over a period of time is through these 3 pillars, we've actually been able to achieve leadership status in the region. So for the last 7 years in the row, we are rated as the #1 hospital in Western India. And we are the only hospital in the region to have all quality accreditations. So there is a tremendous and unflinching focus towards quality, which has ensured that we have the best in class outcomes, and that is why in such a short time frame we've actually been able to become a leadership hospital in the region and amongst the top hospitals in Asia currently.
Wow, that's a great news. And we have oncology surgery department's director. I would like to know something about your department, especially what you are doing in oncology department.
It is one of the center of excellence in this hospital. By comprehensive, I mean all the services which are necessary for management of a patient with cancer are under one roof. So we have various departments, starting with Department of Surgery, we have Department of Radiation Therapy, and then we have Department of Medical Oncology. And like Dr. Shetty said, all of us practice subspecialty. So for example, I am a oncosurgeon, but I do only thoracic surgery and foregut surgery. So similarly, my colleagues do breast surgery, uro-oncology surgery. So this ensures that the patient who come to our hospital get the best possible treatment. You know, we are not generalists. Each one of us is a specialist, even in the field of oncology. And that is as far as the human personnel is concerned. The technology as far as management, surgical management of any cancer is concerned, we have the best technology. We have the best minimal invasive surgical instrumentation. We have the robotic surgery, Da Vinci robot, which is, we have two in fact for the hospital where most of the robotic surgery is done. And then we have Department of Radiation Therapy, where we have three radiotherapy machines, all of which are latest. The Edge is the only one in Asia, and these machines are designed in such a way that when radiation therapy is given, it causes minimal tissue trauma to the normal structures. It focuses only on the tumor. So the outcome as far as control of the tumor is concerned is excellent. At the same time, patient doesn't have too much of a toxicity related to radiation therapy. And then we have Department of Medical Oncology, which is again divided into two, or rather three. We have adult medical oncology, which deals with solid cancers of the adult patients. Then we have pediatric oncology department, which deals with all the cancers of the children. So leukemia, lymphomas, other having tumors, and so many other cancers that children have. And then we have a hemat oncology department, which deal with again lymphoma, leukemia in adults. So in each of these department we have subspecialization, which gives the best possible treatment to patients who come to our hospital. So this is as far as the treatment is concerned. But then the patients with cancers, they need a lot of social support, because once the diagnosis of cancer is given to them, people break down, there is a lot of problems. So we have, in a department, health social worker who deals with, managing patients' social needs, helping them with managing the emotional needs and things like that. And then we also have, unfortunately, a lot of patients with cancer, they come in very advanced stages where, curative treatment is not possible. So we provide also palliative care to patients, pain management, palliation. So in short, the comprehensive department of oncology that we have, caters to patients from the time of diagnosis to treatment, and then also pain and palliation for patients who are suffering because of stage 4 cancer.
Okay. And especially robotic surgery, I would like to know many things about this. I have questions, but before that, Dr. Abhishek Srivastav, I would like to ask you something about what is rehabilitation, and your department. I would like to know something about.
So, rehab medicine is a branch of medicine where we treat people who have functional limitations. We make them independent again. Can they get back to work? Can they go back to their job themselves? So primarily people with illness have disability and pain. So we minimize the disability, treat the impairments. This term has come from US primarily. It is called as physiatry or rehabilitation medicine. A medical doctor who trains in that is called as a physiatrist. Now, physiatrists can do, or this branch can do multiple subspecialty training We can do neurological rehabilitation, we can do sports injury rehab, we can do pain management, we can do cancer rehabilitation, we can do pediatric rehabilitation, cardiopulmonary rehabilitation, palliative care. It helps people in different spectrum of life. And especially in our hospital, for the same mantra what Dr. Shetty was telling, we have a multi-suite trained team which is subspecialized. So we have rehab programs which are tapered for every specific branch. So we have neurological rehab. Patients are seen by a team of people who are trained only in neurological rehab. Then we have cardiopulmonary rehab, we have cancer rehab, we have interventional pain management, pediatric rehab. And these teams have multiple people among themselves. For example, there's a rehab physician or a physiatrist, there's a physical therapist, there's an occupational therapist, there's a speech pathologist, there's a psychologist, there's a social worker, there's orthopedist, prosthetist, nurses, all work together as team to help these patients.
Okay. We have many things to know about Cook11 Hospital, cancer and rehabilitation, but before that we have to take a short break. Dear viewers, please don't go anywhere, stay with us, we are coming back soon. Welcome back. You are watching the show Life Matters and we have three guests from India and they are doctors. Welcome again. Dr. Shetty, I would like to ask you something that you were talking about the advanced technology of medical science. Is it very much expensive in Cook11 Hospital or not?
So one of the key values of the hospital always has been to make healthcare accessible and affordable. So the focus always has been to make this technology easily affordable so that we are able to reach a larger population. When you talk of technology, technology has got multiple values or multiple benefits. So the first key benefit is how does it help in early diagnosis or right diagnosis of patient. For example, in cancer we have technologies like digital pathology, we have gone in for total lab automation, we are going in for a digital PET CT. These are all technologies which will help in early diagnosis. On the treatment side, we have technologies like robotic surgery, we've got radiation oncology machines like the Edge, we've got rehab robotic machines, we've got now robots for orthopedics. So all these technologies play a critical role because they actually help in reducing complications, improving ease of surgery, reducing length of stay. So there are multiple benefits. So if you look at it from an overall perspective, technology actually helps in reducing length of stay, maintaining costs at an optimum level and at the same time giving best in class outcomes, reducing complications. So from an overall cost perspective, actually it works out very much beneficial to the patient. Yes, in certain cases there could be an additional charge for a technology, but from a long term point of view, from an overall quality of life, from a benefit point of view, technology definitely actually makes the cost actually come down compared to it going up. So overall the focus has always been on making technology affordable and accessible.
Now for middle class.
Yes,
also.
that is right. That is right.
Okay.
So we've got very competitive packages that we have for all classes of patients, and we treat patients across all socio-economic strata of society, so that we are able to reach a larger population pool and have this technology available to them.
And for poor people, you have any other arrangement?
So what we have is we've got different categories of rooms depending on patient's ability to pay. So while the same doctor is looking after, the same quality of nursing is there, the same treatment, the same theatres, same ICU, it is just that the room ambience may be a little different. So through this class-wise system, we are actually able to provide care which is affordable to a larger population pool.
Okay, thank you so much. It's really affordable, I think. Dr. Mistry, I told you that I especially want to know something about robotic surgery. In India and in Bangladesh also, we always say that doctor is the second god. When we go to robot, then who is the god, second god? Robot is the god or doctor is the god? What is happening? Should we rely on robot?
No, so this is a very good question, and I think this is something that everybody keeps wondering. You know, when you say robotic surgery, the general impression amongst people is that surgery will be done by robot. That is actually not the case. Robot is just a machine which helps or assists the surgeon in performing the operation. So the actual surgery is being performed by the surgeon, but robot helps us in optimizing the treatment, I mean surgical procedure. We have minimal invasive surgery where all radical operations can be done through keyhole, so you don't have to make big incisions. Patient scar heal faster, patient can go home early, the recovery is much smoother. But in that minimal invasive surgery there are certain limitations. So the robot actually helps in overcoming all the limitations and makes the same minimal invasive surgery easier for surgeon to perform. And of course, apart from that, there are certain advantages, where suturing is concerned, complex movements are concerned. Robot is much better than even human hand. For example, if you want to do suturing, we have limitations in the wrist movement. Whereas robot, the instruments are such that it can move almost 270 degrees. So that makes the whole robot very versatile. It makes minimal invasive surgery very easy, and also the outcomes are much better. So today robotic surgery is used for almost all kinds of surgery, in the chest, in the abdomen, in the pelvis, and it has changed the outcomes for the benefit of the patients. So again, I would like to say, to people in general, that when somebody says robotic surgery, it is not the robot who is going to operate. The surgery is going to be done by the surgeon who is sitting on the console, and robot only assists in performing the operation. It makes things easier for the surgeon, and if things are easier for the surgeon, the outcome for the patient is also much better.
Okay, then a robot is the helping hand of
That's
the
right,
doctor.
absolutely, yeah.
So we are actually relying on a doctor. Doctor is the second god actually. Thank you so much. And Dr. Abhishek Srivastav, I would like to ask you about what kind of conditions can benefit from rehabilitation. Could you explain us this?
Yeah, so rehabilitation is a very wide specialty. Primarily, we treat patients with neurological problems, which is the main focus. People who have strokes, those are brain strokes, brain injuries, Parkinson's disease, multiple sclerosis, they have neuropathy, cerebral palsy, autism. And these people can have multiple problems. They can have memory problems, they can have behavioral issues, vision problem, they can't speak, they can't eat, they have paralysis, can't control urine, can't control motion. So we treat all these 9-10 things with the help of multidisciplinary team. That's the key area. Second is patients who have pain. Now pain can be because of headache, spinal pain, neck pain, back pain, joint pain, arthritis, myofascial syndromes. So we have now interventional pain management coming up. We can do blocks to reduce pain. All therapies are provided along with that. Third, all of us now want to engage in sports. So we are normal people who want to be better and want to play and perform sports. So performance enhancement as well as sports injury is a big area of focus in rehab. Next is cancer rehab. We have many cancer patients who have problems in spite of adequate treatment. They have paralysis, they have lymphedema, they have pain, they need care for that. Next is even pregnant women, those who have antenatal care. We have antenatal care programs. We have postpartum care programs for people who have women who have delivered. Then pediatric rehab services, people who have pediatric stroke, cerebral palsy, autism, learning disability. It's a wide spectrum, covers from childhood patients to geriatric age group to adult population, neurology, sports, pain, rheumatology, cancer, pediatric care, and so on.
Okay. Then rehabilitation is a vast area.
It's very vast area.
Very much
Very vast
important
area.
in advanced treatment. We're coming back to you again. We have to take again another short break. Dear viewers, please don't go anywhere. Stay with us. We are coming back soon. Welcome back to our show Life Matters. So we have three doctors from Kokilaben Hospital. Welcome again. At first, Dr. Abhishek Srivastav, I would like to ask you another thing, that why rehabilitation is important, or why not the neighborhood physiotherapy?
Very good question actually. So rehabilitation is a very wide concept as we discussed. It consists of treating patients right from acute stage. Suppose somebody had a brain injury, had an accident, he come to the ICU, brain surgery is being done. He's not opening his eyes, multiple tubes are there. Rehab starts from there. So we start seeing those patients right from that acute stage, help them removing their tubes, then treat them all the different deficits, make them better. So one, it starts in the acute stage. Second, it needs multiple team members. The team consists of a rehab physician like me, a physical therapist, an occupational therapist, a speech pathologist, a psychologist, an orthotist, a nurse, which is a much broader concept. And third, especially in our hospital, what we have done, we have inpatient rehab programs. So we admit patients for rehab. Those who are not able to speak, talk, walk, have tubes, they come to the hospital primarily for inpatient rehab service, and they are seen by all the different specialties every day to make their life better. Second, that needs one a team concept. Second, it needs a lot of technology. We spoke about rehab robotics. So just like robotic surgeons are using robots to make surgical things easier, we have machines where a person who has paralysis can also help with the help of robotic assistants. So we have 2 rehab robots for walking called as Locomat. We have 3 upper limb robotic systems. They're called as Armia concept for only for upper limb movement. So these stroke patients or brain injury patients who have paralysis, this type of training, it's much more better when it is combined training of robotic with conventional therapy approaches. Third, what it requires is space and team. Now, in our hospital, one full floor is dedicated for rehab, which is 30,000 square feet area. So out of 16 floors in the hospital, one floor is only for rehab. So we have all these people who work in rehab are on the same floor. So we can take care of everything. So we have technology, we have trained team, and we have subspecialty programs, and all available on the same floor, which is not possible in nearby physical therapy. Near the clinic can avail physical therapy with basic equipment, which is only one part of rehab. You need a whole team to help these patients.
Okay, so actually rehabilitation is a vast area, including the physiotherapy. That's the point. Thank you so much. We can understand that after your speech, Dr. Mistry, I would like to know something about when a patient or a family know that they are suffering with cancer, what they should do, and how can we prevent cancer?
So, any illness, but more so cancer, the diagnosis of cancer is associated with a lot of fear, lot of panic. In fact, once you tell patient that he or she is suffering from cancer, the general impression is that it is incurable. Cancer is cancel. There is end to the life. But that is really not true. Actually, cancer is a chronic disease, and if it is diagnosed in an early stage, there is very high chance of cure. So if the patient is diagnosed in stage 1, the treatment is very simple. It could be just surgery or it could be radiation therapy, and patient will be cured. As the stage at diagnosis increases, the outcomes become less and less favorable. But still, a lot of patients with stage 3 cancers can also live long enough. And in fact, now the advances in immunotherapy, targeted therapy helps in improving not only the quality of life but the overall survival of patients with stage 4 cancers also. So for example, if somebody is in stage 4 cancer, lung cancer, previously the outcomes were very dismal. Normally we would say he or she would survive for 6 months, 1 year. But now we have medications available. So in patients with favorable markers, we can treat them with simple pill every day, just 1 tablet he or she has to take. And the remission rates are very high, control rates are very high. Similarly, there is marker for immunotherapy. This is something which is very new, and if those markers are favorable again and you treat the patient with immunotherapy, then there are patients in stage 4 cancers who are surviving for years together. So a lot of advances have taken place in cancer, and one should not lose hope if the diagnosis of cancer is made, because there is a fair chance that patient will be cured, or even if he or she is not cured, we can make them live for long and also the quality of life can be improved. Answering your next question, is cancer preventable? Now, this is the most important question because almost 70% of cancers are associated with our lifestyle. So, if you are obese, then there is higher risk of developing certain cancers. If you are physically inactive, sedentary lifestyle, again it is associated with higher risk of certain type of cancers. But the most important risk factor is tobacco. Tobacco is, cause for, if I talk about lung cancer or oral cavity cancers, head and neck cancers, almost 70% of these cancers are because of tobacco. So just imagine a situation in the world, if tobacco was not there, 70% of these cancers would not be there. So I would like to again re-emphasize that cancer is a highly preventable disease. If you live life in moderation, avoid alcohol, avoid tobacco completely, a lot of patients whom we are seeing will not be seen. They will not develop only cancer. So it is very important to have, avoid tobacco, alcohol, don't live sedentary life. Physical exercise is very important so that you have optimum weight, and all these things, are actually highlighted by WHO as part of preventing development of cancer. So, healthy food, keeping your weight correct, avoiding all the bad habits, and you will prevent almost 60 to 70% of the cancers that we are seeing. And naturally, if you prevent cancers, then death resulting from cancers are also going to reduce markedly.
So lifestyle is the most important thing,
yes,
for preventing cancer. Thank you so much. Dr. Santosh Shetty, we would like to know something about Bangladeshi people. How can they avail Kokilaben Hospital's advanced treatment?
So Kokilaben Ambani Hospital attracts a lot of patients from various countries. Bangladesh is also one such country from where we get a large number of patients. We have a dedicated international marketing team which coordinates everything end to end, which is basically collecting details, getting the reports, getting the estimates done, sending the visa invites, and also ensuring that there is a first level consult which happens. Based on the response and feedback that we've got from Bangladeshi patients, we are very proud that this evening we are actually opening an information center in Banani for the benefit of Bangladeshi patients. So at this center we will have our own team which will guide the patients about the doctors, the services. They will also be able to coordinate with the doctors in Mumbai, share the reports. This center will also have a telemedicine facility so that patients can do a first level consultation to decide whether they should be traveling to Mumbai for further treatment, what should be the line of treatment. Similarly, patients after surgery or after treatment, once they come back here, they can do an online follow-up and continue to be in touch with the doctors in Mumbai. So through this information center, we will try and reach out to more and more Bangladeshi patients. The whole idea is that we want to make this healthcare, which is the best in class healthcare, accessible to Bangladeshi patients through this information center in Banani. So through this center, we hope to reach out to more and more patients and make this healthcare accessible to them.
Okay, how many doctors will be there?
So right now this will be an information center where we will have administrators who will coordinate everything.
Okay.
There will be doctors who will periodically come to the center, which could be once a month, once in 2 months. At the same time, this facility has got a telemedicine equipment over there through which there will be an online consult possible, reports can be exchanged and detailed plan of treatments can be discussed. So both pre-visit as well as post-surgery or post-treatment, that care can be provided through the center.
But we can't have any surgery here or a critical health care.
Yeah, so
not possible right now.
So right now we want to start with an information center, and over a period of time, I'm sure we will be setting up a hospital at some point in time here in Bangladesh.
Okay. Do you have any plan for say a hospital here?
Yeah, I'm sure in the very near future we will definitely look at setting up a hospital here as well.
Thank you so much for coming to our studio. That's all for today. Maybe another day we can discuss another issue. Thank you so much again. And dear viewers, thank you for staying with us. That's all for today.